Welcome to Drug Error Talk. I'm Matt Hamilton. Today we're talking about Lovenox, its effect on the human body, how errors are made in the dosage, the damages that can result from those errors, and what should you do if you're a patient or know one and they've been given an error in dosage. I'm joined today by Dr. Jesse Garcia. Welcome, Dr. Garcia. Sir, what is your area of specialty?
I am a clinical pharmacist specializing in drug interactions and the effects on the human body.
Okay. It's a strange name, Lovenox.
Lovenox,
What
correct.
does it do? I don't think it's a love potion.
No, it is definitely not. Lovenox is the brand name. The generic is enoxaparin, but we typically just say Lovenox because that's what most patients who have used it, know it by.
Okay. What does it do in the human body?
It's a class of drugs that is similar to another class we've discussed in terms of heparin. This is called a low molecular weight heparin. Basically, it's a lot more of a cleaner heparin, you would say.
Okay.
Used to cause anticoagulation or prevent blood clots. Patients that we would see who might use this would be patients that may have had a pulmonary embolism, basically a clot in the lung. You might see this in patients who have had hip or knee surgery.
Okay.
In some cases, if a woman was pregnant and she had a lot of miscarriages, then we might use this medication for a period of time to help kind of prevent the miscarriage.
Okay, I see. So pregnant women, people with heart attacks?
People with heart attacks. In some cases, if they had a heart attack, sometimes they'll use this as an anticoagulant as well.
Okay. So either assisting in pregnancy or preventing blood clots.
Correct.
Okay. Do you see errors either by a physician or the pharmacy or another medical professional in how it's administered?
In terms of dose?
Yeah. Can that be a problem?
Yeah, that can be a problem. Administration can be an issue as well, but we'll start with dose. Dosing is, there's strict dosing or strict doses that you can get. Basically, lowest dose that is available is a 30 milligram syringe. Okay, these are pre-filled, so you don't have the ability to put in more or take some out to individualize. So you're kind of getting in a range based on the patient's weight. And
so these syringes are filled in advance? In advance,
correct.
Can somebody grab the wrong syringe?
You could potentially get the wrong syringe. They're color coded, but if you think that the 30 was blue and it turns out it was yellow, these ones we see more. They're more commonly used, so you could potentially see the issue of grabbing the wrong one.
Okay, I see. So other than grabbing the wrong syringe, is there a conversion problem?
There can be a conversion problem. So what we see in some cases is patients might be moved from one drug to the other. So in terms of, say the patient is going to be, say they have AFib, and they're going to be on a long-term therapy.
What is AFib?
Atrial fibrillation. It's basically a quivering of the heart that can cause the formation of a blood clot that then can move to the brain, cause a stroke, or pulmonary embolism, move to the lungs.
Okay.
Okay.
All right.
And so what we might see in these specific patients is we might see that the medication is not used properly in the conversion. So say the patient has long-term therapy is warfarin, we said. So warfarin takes a few days to get going. It takes about 4 or 5 days. So you would want to start a patient on Lovenox or enoxaparin to get them started so you can get the anticoagulation effects. And then after about 5 days, once you know the warfarin is where you want it to be, then you would discontinue the medication. Okay.
Is weight an issue?
Weight is definitely an issue. And weight is an issue, and the reason for the medication is an issue. So whereby if, in the case that we were saying, we're going to get them to the point of eventually switching them to warfarin.
Okay.
So those particular patients, we would want to go based on their weight, based on kilograms. And so you would dose it based on their weight. So if you have a patient who is low weight, like a low weight adult, or even an adolescent who might be prescribed Lovenox for blood clotting, or you have someone that is a larger person, possibly obese, those are the end spectrums, and that's where you can potentially see problems with dosing. And then the other caveat to it is you have some patients where you're just using it to prevent clots while you may be hospitalized. Maybe you're not moving as much. and so they use it to prevent the potential for what's called the DVT, or deep vein thrombosis. And so in those cases, you would have to do specific tests on the kidneys to choose the correct dose.
Okay. So somebody that's very light in weight or very heavy in weight is a particular concern, but weight and the degree of use is an issue either way.
Either way, it won't make a difference, because you could have a patient that, say they weighed 185 pounds, but their kidney function was decreased. You still might be giving too high of a dose.
Well, I mean, can an error be made by failing to properly check a kidney function?
Correct. If you don't do the calculation to get the calculation is called creatinine clearance, which is basically the ability of the kidneys to clear creatinine, which is it's basically a breakdown of muscle.
Oh, I see.
And so we have a normal breakdown of that, and it's being cleared through the kidneys, and so that measurement is what's used to determine the kidney function, so to speak.
So if somebody makes an error in how they're interpreting that, then that could lead them to giving the wrong dosage for...
Correct.
Okay.
Now, everything else in the system could be fine. It's administered correctly, patient's getting it on time, but because that initial function of checking the kidney function was not done properly, that throws everything else and just causes that domino effect.
Well, Doctor, we've talked about how errors in a dosage can be made, but we've skipped over the administration, how it's given.
Okay.
Can that be an issue?
Yes, most definitely. Lovenox and enoxaparin both come in pre-filled syringes. And the unique part about this is most every time you see a syringe on whether it be on a commercial, TV, anytime you ever have seen one, you typically see the syringe turned up with the pointy end up, and you push on the plunger and you try to get the air out.
Certainly.
Lovenox, that is the complete opposite for Lovenox. In Lovenox, you hold it more like a dart. Okay, there is an intentional bubble that is in there that helps ensure that you get the full dose. So part of that is you're supposed to do a Lovenox teaching whenever you prescribe that. So Lovenox, before it went generic, had an entire kit that was dedicated to patients that were being started on Lovenox to go over this information with them, show them how to use it. The fact that you have to do it in kind of a fatty tissue, and you should alternate left to right and then go up or down. Okay, so there's a specific pattern that you're supposed to use, and then the actual administration itself, as I said, pointing down and making sure that bubble remains in there, because that bubble is ensuring that you receive the full amount. Whereas if you didn't and you kind of turned it around and pushed up like you normally would to try to get that bubble out, you'd lose the medication, and you'd lose a lot of the medication that's in the actual syringe itself that never makes it into the body.
So there are lots of ways that the way in which it's injected into the body can create a drug error.
Absolutely.
Okay. And it's compounded by the fact that it's not the normal way to give the drug when compared to other types of drugs that these medical professionals might be administering.
Correct. It's a different syringe. It goes against everything that you've most likely ever seen with any type of syringe. The typical mannerisms for those types of syringes are you take the syringe up and you always see it pointed up where you're looking at the bottle. In this case, you do the exact opposite. It is intended to be pointed down so that when the medication is actually injected, it's going into the skin as it's moving down, and that bubble is intended so that you can actually make sure that full dose is administered.
Well, you mentioned there might be multiple drugs involved. Are there any issues with, say, starting it or stopping it?
Exactly. That's where we come into effect of depending on what your end result is. Are you going to be on, in the case of maybe a hip replacement or not hip replacement, atrial fibrillation, and they're going to pick what the long-term therapy is going to be. That changes, the administration changes based on whether or not you're going to be on warfarin, or whether your end medication is going to be a drug, say, like Pradaxa, or your end result medication is going to be Xarelto. Depending on what your end drug is, there are different conversion factors, and likewise, if you're coming off of warfarin and going on to Lovenox, there's a conversion that needs to take place, and that needs to be monitored very closely because in some cases you're going to have multiple anticoagulants on board at the same time.
Gotcha. So when we're talking about an error that a medical person might make in the starting and stopping of Lovenox, it is the start and the stop is the start of Lovenox and the stop of Lovenox when compared to taking different drugs.
Correct.
Okay.
Correct.
So it could be a drug in the middle of doing multiple things.
Correct. You might be raising the level of one drug and decreasing the level of the other drug at the exact same time.
Wow. Okay. Well, if this happens to you and one of these many errors occurs with Lovenox, what are the consequences to the patient?
Consequences for the patients obviously are going to be bleeding. If you don't administer it correctly, you can have massive bruising. I mean, I'm talking silver dollar sized bruises up and down the sides of your stomach or leg, depending on where you choose to do the injections. So that in and of itself is going to be a bad deal for you, as well as potential hematoma, which is collection of blood outside of the closed system, the heart and the veins and such.
So if an error occurs, it can create bleeding and bruising in your body where you're not supposed to have blood, not supposed to have bruises.
Correct.
Is it any different, the consequences, is it any different if you're a different age?
Correct. As you age, you can be sensitive to certain drugs. And when I say more sensitive, increased risk for side effects, and this is definitely one of those.
Okay. Well, okay, so let's say you're a patient, an error has been made with you and you're getting these hematomas. What should you do?
Getting a hematoma, you have any type of blood issues or in terms of clotting, you definitely want to get seen. And this is also a case where you'll want to bring that medication in with you. You want to be able to show that because, like I said, some cases, the 30 milligram and the 60 milligram or 30 milligram, 60 milligram to 150 milligram dose is all right next to each other. And so, the drug...
So you want to bring in the exact medication that they gave you?
Correct.
Is there anything else you should bring?
You want to bring your medication list so they can look at whether there's any other potential interactions. If you're on a titration, which is like we were talked about earlier, where the one dose is going up, the other one's coming down, you want to bring that in and say where you are in that schedule.
Okay. So they bring their medication list, the list of all the medications that they're taking.
Correct.
They bring in the exact medication that they were giving, if they can, so they can look and see if it's the right one.
Correct.
Okay. Well, what time period are we talking about when they come in?
This is not a wait and see. This is a definitely get in, get seen, ER type emergent situation. This is
so you don't even wait till the next morning?
I would not.
Okay. Dr. Garcia, it's been real informative. Lovenox is not quite what its name implies. This has been Drug Error Talk. If you need additional information or if you're doing research on Lovenox and you're concerned about an error, you just want to know more, I direct you to our website. It's worldwideweb.law-kc.com. In it, you'll have additional research materials and also links to some of the best sites that can inform you more. Also, we have additional videos on our YouTube channel if you'd like to see it. I'm Matt Hamilton, and this has been Drug Error Talk. Dr. Garcia, thank you. It's been a pleasure.
Thank you.